Plus, August is Psoriasis Awareness Month. We have a doctor joining us with more about this chronic condition, from the symptoms to treatment options.
Celebrities like Kim Kardashian, Cyndi Lauper, and Leanne Rimes are among the 8 million Americans living with the chronic skin condition psoriasis. August
is Psoriasis Awareness Month, the time to learn more about the symptoms and treatment options. Joining us now is Dr. Elroy Vojdani. Good morning to you.
Good morning.
You are a pioneer of what they call functional medicine and blood testing. I couldn't explain that, but perhaps you could, and it's a pleasure to see you. Let's talk a little bit about psoriasis and eczema, which some people get confused. What's the difference?
So they're both very common skin conditions and can look very similar. Eczema is a general inflammatory condition, which means that the body isn't specifically attacking the skin, that the symptoms are from a general process. Psoriasis is an autoimmune condition, which means that the body is specifically attacking the skin as an accident, actually.
And how does it affect a person's daily life?
I think both skin conditions really affect someone's daily life. Because psoriasis is so severe and can affect so much of the body, it really does affect your appearance, your self-confidence, and it can be very painful. And because of that pain, that's also a big debilitating thing for people in their lives.
And is it a flare-up sort of thing where people will not see it and then it comes rearing its ugly head again?
Absolutely. Like all autoimmune diseases, they come and go. There are moments, depending on how stressed you are, what you're eating, that the symptoms will be worse.
All right, you brought up eating. How does diet play a role with psoriasis?
I think with psoriasis, you can think of your skin as being a window into your gut, okay? So the more healthy your gut is, the less the symptoms are going to appear. So part of that, of course, is your diet. And I tell all of my patients that trying to eat in an anti-inflammatory way is really key for managing the symptoms.
All right, specific foods to eat or not eat?
Yeah, definitely. Specific foods that you want to eat. First, think about probiotic foods. So things with live active bacteria in them. That's kefir, kombucha, kimchi, sauerkraut. Those things are great to
sauerkraut.
include.
Yeah. Yeah, we can handle that. That we can, okay.
So we need to go to the German restaurant.
Some kimchi, if you like your local Korean LA
And what
food.
is it they're doing in our body to help with the condition?
The bacteria that are living on those foods actually go into the gut and send signals to the immune system that everything is okay. We really depend on those bacteria to tell the systems inside we're doing well.
What are the treatments for psoriasis?
There are lots of standard treatments that really revolve around controlling the immune system. That ranges from general immunosuppressants. There are injectables that control different arms of the immune system. And I also think that the symptoms can be really well controlled with lifestyle interventions, making sure that you're not eating inflammatory foods like gluten or dairy, consuming lots of fresh salmon and trout, and also ingesting a lot of anti-inflammatory foods like turmeric and ginger.
Okay. When it comes to babies, and is it a condition that you can spot that early, or can it appear at any time in your life?
I think, unfortunately, today, chronic inflammatory and autoimmune conditions are affecting babies way more than they were 10 or 15 years ago, so it is common in babies. You can spot it immediately. And a lot of the same things that we do for adults hold true for babies as well.
Yeah.
Removing dairy from their diet is very helpful in many of those cases, consuming probiotics and taking vitamin D.
Okay.
All right, to learn some more about psoriasis, go to regeneramedical.com. Thank you so much for coming in.
Thank you, doctor.
My pleasure. Thank you, guys.
Appreciate it.